Pootie-tang! 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 Zapatow. Hey, welcome to Candid Travels, Texas. Today is a really dreary day. If you look around in the living room and look outside, it is muggy and it is really, it's a hugely muggy and humid day. And what we have here is Pootie-tang! Pootie! Oh, Pootie-tang! Okay, so Pootie-tang is a movie that I recommend to... I know it looks weird, right? Check it out. It's a great movie. It's funny. It's highly recommended for anybody who's a patriot. And you'll understand once you see it. It's nonsensical, very funny, okay? He has a magical belt. Here's that belt buckle. A couple of weeks ago, you saw me wear this belt buckle. All right, so that's the first little tip. Now, a couple other tactical tips I wanted to mention is this is a book, if you can get a hold of it. It's called The Shepherd's Diet by Christina Wilds. And here's the other book that is at Brave New Books called Why Is Gilligan Skipper and Why Is Gilligan Skinny and the Skipper Fat? It's a ketogenic primer that ATX ITAC sells with tons of fun little pictures. There's Gilligan and Skipper. There's pictures of Arnold Schwarzenegger. And you can actually contact us at Lovingly Stone Productions, and we can actually tell you how to get a copy, and we can have it mailed to you. There's a samurai watching Gilligan's Island. How do sumos get fat? They eat like once a day a lot of like sugars and things, and then they sleep for 20 hours. Okay, Generation X, and the author Gilligan, and this is a very interesting thing where you can see some people might deem this socially, politically incorrect, but there's an Asian American guy, average chubby guy, an Asian in Asia, like in old Asian countries, not like communist China right now where it's kind of starting to become, westernized, and why they tend to be thin, and there's Mr. Sumo. There's a guy who has tons of muscles, but his body fat percentage is way low. And we have had people who are bodybuilders die because before competition they lower their body fat level to very low levels. Author wanting to be a sumo. Also, obviously, stress is a huge factor in fitness and overall health. Anyway, what a great book. And I believe it's $12 and less in Canada. Wow. All right. Speaking of Canada, hey, so here we are. I wanted to mention another tactical tip, which is from a Canadian medical doctor by the name of Dr. Jason Fung. I've mentioned him before, but Dr. Fung is a nephrologist. He is a kidney specialist, and he specializes in the type 2 diabetes and clinical morbid obesity. And anything you find on him on the internet is great stuff. Just listen to the gentleman. He is an incredible doctor. And one of the things I heard him say is very little known fact. It's a tactical tip that fructose, which is fruit sugar, cannot be digested by the human body. Okay? Now, as somebody trained in in the Bible, it kind of makes sense because in the Garden of Eden, it was actually the fruit of the knowledge of good and evil that you're not allowed to eat. Very interesting. It's that fruit in the center of the garden. If you eat it, you shall die. Now, conventional health and wellness will teach you that, okay, eat fruits and vegetables. Eat fruits and vegetables. But then, how come in the Bible, in Genesis, it says that you can't have the fruit. It says the seeds are for you to eat, but not the fruit. So it makes absolute sense if you think about it with common tactical sense. And that is this. Fruit is the covering for the seeds for the future generation of a plant or the tree. And it's designed so that it will protect the plant. If animals eat it, they'll die. Okay, large quantities of fruit eaten will cause an animal or human to die. And the reason is because, Dr. Fung mentions it, and this is all based on clinical study. Now, the statement that, oh, fruit is good for you, give it to your kids, there has been no human studies done on this. This is just hearsay. There's a lot of that in conventional wisdom, okay? But studies have shown that fruit sugar or fructose is not digestible within the human body. So it's stored in the liver. Now, what does the liver do? The liver stores things that can't be digested. Sometimes alcohol, like if you drink a lot of alcohol, you have liver problems, right? So toxins and such. So you've got to be careful on how much fruit juice and how much fruit you eat, all right? So that's a tactical tip. Research that on your own before you take my word for it, and consult your doctor. But just remember, many doctors are not trained. So Dr. Jason Fung is another tactical tip. So, here, I want to show you something. This is yesterday. Allison and I went to the Splash Bash 2017. And the weather was like today, dreary, and completely rainy and crappy. So usually the Splash Bash every year at University of Texas at the Gregory Gym pool is like a huge spring break party at the leisure pool. We have games. We have like little huge blow-up hamster balls. But yesterday, there was absolutely no way we could be outside. It was lightning and stuff. So they set up these photo booths. They have me wear these funny costumes, and Allison didn't want to do it at first. And so that it is. And they gave us these Frisbees at University of Texas promoting Amazon. Okay. Anyway, so I'm going to bring Pootie Tang to Sugarland, Texas today and share it with a pathologist and a chemical engineer, family members. And then what we're going to do is we're going to drive we're not going to show that part, okay? You got to watch that movie on your own. Then what we're going to do is we're going to go to Gaido's restaurant, where our pet goldfish here, remember him? Gaido. There's Gaido, named after the restaurant. The oldest seafood restaurant in all of Texas at Galveston Beach. And there is going to be a Texas Pathology Day Conference. So we're going to have dinner there. It's actually not day, it's a dinner. It's a dinner conference. We're going to have pathologists present some new findings. So I'm doing my doctor gig today. It'll be fun. So we'll be able to bring you to the beach to see how it looks like. Even here in Austin, it is really, really bad weather. And even if it's raining over there, it's okay, because we'll get the salt air. I'm going to try to give some salt air through the camera for you guys. All right? By the way, here's another tactical tip. This is my dog, Rex. Rex Plus is an electronic dog. He's an alarm system. Anything within like a 25 feet perimeter, even through the walls, he will bark. So I will know somebody's around. By the way, these amazing paintings are for sale, okay, for wealthy people. All right, so you can contact us through the comments below if you want to know how to get a hold of these. All right, on our way to Galveston. All right, so before we head, I wanted to show you guys this, and they're bug out bags. All right, we're in Sugarland, Texas, taking a little break, And Texas Colonel Stone is going to be dining at Kentucky Colonel Sanders's tactically eating of KFC, made the hard way since 1940, made by hand. So behind me is pictures of the original celebrity Kentucky Colonel Sanders. Here I am, celebrity Texas Colonel Stone. We're eating original recipe dark meat. And there he is in the Middle East. Very interesting, huh? Here he is with Mickey Mouse and Cinderella, Alice in Wonderland. And here he is with a monkey on his head. And here he is. Yeah, in real life, his actual rank in the Army was that of a private. So it's an honorary Kentucky title here. And this is his running for senator in Kentucky. And it's Colonel 101. White hair to match the suit, spectacles, charming smile, lapel pins. So what do y'all think? Should I get a white suit? If you want, leave a comment below. So we're just stopping over for a little extra meat before we have our main meal at Gaido's restaurant with the fish at the Pathology Conference with a lot of other doctors, MDs. These are MDs, okay? Reverend doctors. Finished eating and all dark meat, KFC, original recipe. Colonel Sanders, Colonel Harlan Sanders. I will never pass anybody up. All right, on our way to Galveston, Texas. Check it out. Wow, look at that water. We're gonna probably head over to Rainforest Cafe for a little bit before we go to Gaido's for the Pathology Conference. And here's the Gaido's. You can see Nick's. Now Nick's is the new younger generation family member that created a restaurant next to Gaido's that's less formal. But Gaido's is still the best. It's the best seafood in all of Texas and the oldest restaurant in Texas. So we're headed to Rainforest Cafe straight ahead. Rainforest Cafe. A river forest. What's that? Oh, look at the gator. Look at the alligator. Whoa! Here in Galveston, Texas. Wow, look at that. Look at that. I'm going to take a big spin, look around me, and look at behind me of the ocean. Look at that ocean. It's a good surf day. Okay, so I decided we were all going to go on the river adventure ride. Here we go. It's only about a few minutes ride before we go to Gaido's for the Pathology Conference. Look at this. This is pretty cool. We're here in Galveston, Texas. It shouldn't be too bumpy. But we're inside the boat. There we go. Whoa! Water. It won't get wet. So we're spinning. Oh, we go. Oh! Big frog! Oh, I don't want to lose it. I better. Here we are. Beginning of the ride. Oh, wow. Can't see Allison. Oh! 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 Oh my gosh! Monkey. Oh, oh, oh. Oh! 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 It's a waterfall. Oh! Elephants! Oh! Elephants! Baby elephant! Oh! outfit. Yeah, okay, he actually did a good job filming this ride because it's not easy, it's spinning around. And it's, maybe they turned the lights down. Whoa! Look at that guy's face. Oh. Yeah, we just finished the ride. So we're at the jungle part of the inside of Rainforest Cafe, and this is where they build a bear, and you can put a heart. These are little hearts that go into your bear. You pick a heart, and you put it in to a bear, and they stuff them, and they have all kinds of different. There's Allison.
They also build a bear.
One last thing. You see all these fish. Before we go. It's fun to just watch fish sometimes, isn't it? Whoa, look at that. Luminous beings, aren't we? Not just this crude method. And we're usually greeted by this statue, the boy with this is Cupid Gaido. That's her later, and that's her picture of her, the wife of Mike Gaido, who created this restaurant. Here are some pictures.
Yeah.
Excellent. And there's.
Are you a newspaper reporter?
Yes. No, I'm actually a professor of psychoneuroimmunology. Conference hall. We get to enjoy a nice pathology conference with an awesome dinner at Gaido's. This is nice. Here we are.
It's very hard to find partners.
We're a little bit early, and we'll be getting ready to start soon.
And then we opened it up to the public, and then the new owner took over, and the business wasn't there, so we closed it down. Now we use it for
conferences,
Yeah, our private events.
And it's a private bath. Pelican Club. Now it's a conference center. Yeah. All right, and there is our room for the pathology conference. Dr. Timothy Allen is an MD as well as a doctor of jurisprudence. Real-time anatomic pathology diagnostic management team conference. Waiting for the conference to start, and Allison is looking at these pictures of the Gaido family. It's the oldest seafood restaurant in the state of Texas, and this area was actually called the Pelican Club, like I said earlier. There's their kids and their grandkids and great-grandkids. But now it's open to the public when we have professional conferences and events here. Tom Pazzi. This is the family wall. And the restaurant is named after this oldest family here in Texas. This entry photo. And this is obviously from the 80s. And Allison said she had this outfit when she was that age. And this looks like a completely timely photos. This is from RKO Pictures Incorporated from New York City. Gaido's Hotel back then. So there's a hotel, obviously. There's some pictures here. And these are all the other pathologists that are waiting to come in for this conference by Dr. Timothy Allen. And let's see, here's some more pictures here. Rotary pilot. Oh, more photographs. More photographs, yeah, there we go. And there's Muhammad Ali. Muhammad Ali here with Mike Gaido. And here's the Bushes. Bush, number 41, president. And a favorite place for them to eat here. Some pretty amazing pictures from Bush. And this is an old sign from the current restaurant location, what the sign originally looked like.
as Vice President to convene over tonight's meeting. I welcome you to the Galveston version of the Houston Society of Clinical Pathology. We are very honored to be here and very excited to hear Dr. Tim Allen speak to us tonight. But before we bring him forward, I would like to introduce the chairman.
So I think I have Tim's bio in my head. Is Tim here?
Yes.
It's right there.
All of a sudden I was worried I had to give his talk. All right, Tim, tell me if I get this right. So Tim was an Aggie. Actually, was born in Paris, Texas.
Paris, Texas.
And graduated from Texas A&M. Went to medical school at Baylor. Decided he wanted to be an obstetrician gynecologist and did that for a year and said, oh my gosh. Did ABCP at Baylor and then joined the faculty. After joining the faculty for several years, he decided he wanted to get a law degree. And it wasn't just a law degree that was at a local college. He went to the University of Chicago, left his job as faculty, went to the University of Chicago, graduated cum laude with a JD. Practiced law for several years and then said, my roots are in pathology. Went to Tyler, Texas, was there for several years, and then UTMB was looking for pathologists in the surgical pathology area, found Tim.
Uh-oh. Everything okay?
It's still attached.
All right.
Better than before. That was with one beer only.
One beer only.
Well, we have a little competition, so if you can't hear me, just wave your hand or something.
There's a microphone.
Let me see.
Oh.
This is better? Okay. I do like to wander a little bit, so I'm not sure I can, I'm not sure I can afford the cable up here. But I'll try to stay a little locked right here for the moment, and we'll just take it from here and see how it goes. You can't hear me okay?
Patrick Swayze in Roadhouse. Real-time anatomic pathology.
And using that in their diagnostic decisions and therapeutic decisions, he says, look, the internet's fundamentally altered the way our patients look at medicine. They're more engaged, they want to see their treatment options, and they really are doing this at a time when we're changing our cancer treatments, especially, but other treatments too, from the large anatomically defined heterogeneous groups of cancers to the more subspecialized, molecularly defined subgroups. And so this goes hand in hand with patients' needs and a better understanding of their diagnosis. Basically, I'm saying that pleuritis is a benign condition of the pleura, and I say if you would like to, thank you very much. If you'd like to see your tissue slides under the microscope with me or simply discuss your pathologic diagnosis, please call and I put a number. And then I describe pathologists or medical doctors who specialize in diagnosing disease. This report contains the findings of your pathologist, a physician for regulatory purposes. Again, some of my colleagues get very uncomfortable with this concept. But there is resistance. Not only is there
Hey, I'm great. I had this gentleman here. My name is Alfredo, and I'm the patient today. Oh, wow. I'm 63 years old, live in the USA, and about 3 years ago, I mentioned to my colleague, Dr. Walzer, that I had a PSA level in the 9 range. He said that he was doing a study involving imaging of the prostate by MRI, and I had never heard of magnetic resonance imaging of the prostate, so I volunteered to be a test subject. We were both quite surprised when he actually found something abnormal in my prostate image. Dr. Walzer, could you recap what happened for us? So So on the left here, I'm going to start scrolling through the T2 weighted image. This is Alfredo's pelvis. And as we go through here, you can see that in the anterior part of the transition zone, there's a lot of a dark signal here. There's some bulging anteriorly. This is pretty far in the front. We've seen so far, and taking into consideration the overall patient health and your other comorbidities, given the fact that you're a relatively healthy guy with no major medical problems, who has
how we can battle back by showing our value and showing true patient impact, and then have our patients lobby for us, demanding that we get paid for the services we provide them. So I think the opportunities are abound for an anatomic pathology, and so for transplant cases, for non-malignant diseases such as medical renal biopsies, medical kidney biopsies, interstitial lung disease, which is my thing. There's no reason we can't utilize this in a setting.
Yeah, Dr. Allen, yeah. So we're done with the conference, and we are going to say goodbye here at Candid Travels, Texas. This is the Rhyme Room. And on the way out, yay.